Hi everyone. In today's clip, I will talk a little bit about neuropathy. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. Neuropathy is a condition resulting from nerve damage, which can cause a range of symptoms including pain, numbness, tingling, and muscle weakness. The approach to healing neuropathy often involves a multifaceted strategy that addresses the underlying cause and the symptoms. This can include conventional medical treatment, lifestyle modifications, and complementary therapies, sometimes referred to as integrative or orthomolecular approaches. Whether neuropathy can be fully reversed depends largely on its underlying cause and the extent of the nerve damage. If neuropathy is caused by, let's say, vitamin deficiency, an infection, a tumor compressing a nerve, or high blood sugar levels, in diabetics, addressing the root cause can often lead to significant improvements or even complete reversal of the symptoms. In some cases, particularly if nerve damage has been long-standing or severe, complete reversal may not be achieved. However, even in these situations, treatments can help manage symptoms, slow progression, and drastically improve quality of life. The symptoms sort of include numbness, tingling, or prickling sensations, sharp jabbing, throbbing or burning pain, extreme sensitivity to touch, muscle weakness, cramps, or atrophy. Also loss of coordination and balance, issues with automatic body functions like digestion and blood pressure. Conventional medicine for neuropathy is primarily focused on pain management through medications like over-the-counter pain relievers like ibuprofen and aspirin, certain antidepressants for even individuals without depression, anti-seizure medications commonly used for epilepsy, which can also reduce the nerve pain, topical treatments like capsaicin cream or patches to help by reducing the transmission of pain signals. Or stronger painkillers like tramadol can be prescribed for severe pain, but are generally used for short-term durations due to addiction risk. Managing conditions like diabetes through high blood sugar control, autoimmune disease with steroids or immunosuppressants, or infections is actually crucial. Now, physical therapy can help improve strength, balance, and flexibility and manage pain. Surgery at times may be an option if neuropathy is caused by nerve compression, let's say from a tumor or a herniated disc. Then we have immunoglobulin therapy, or IVIG, which is also recommended for certain autoimmune-related neuropathies like Guillain-Barré syndrome. Then we have orthomolecular medicine and nutritional approaches for neuropathy that suggest that disease is a result of imbalances and deficiencies in the body's optimal nutritional environment, and it emphasizes the use of vitamins, mineral, amino acids, and other nutrients, often in much higher doses than recommended daily allowance, to address these imbalances. In orthomolecular medicine, basically we focus on vitamin deficiencies, as several of them are linked to neuropathy. And supplementation does help, and it is very much individualized, such as B vitamin, which can be B1, B6, B12. These are crucial for nerve health, and deficiencies, particularly in B12, are a common cause of neuropathy. A B complex supplement or individual B vitamins can and may be recommended. Then we have vitamin D3 and K2 deficiency that has been linked to neuropathy, and vitamin E, as it also helps play a role in nerve health. Alpha-lipoic acid, or ALA, which is an antioxidant, and it improves nerve function, and reduces the symptoms, particularly in diabetic neuropathy. Omega-3 fatty acids found in fish oil, and it has basically anti-inflammatory properties and may help reduce neuropathic pain. Magnesium, which is involved in nerve function and muscle relaxation. Amino acids such as GABA and glycine are also considered inhibitory neurotransmitters that can help calm nerve impulses and muscle spasms. Coenzyme Q10, which is an antioxidant that supports cellular energy production. And if the neuropathy is due to type 2 diabetes, we have seen great response through dietary supplementation of benfotiamine, specifically, well, generally 250 milligrams 4 times a day, vitamin B6 250 milligrams a day, and pyridoxal 5-phosphate or P5P 100 milligrams a day, magnesium complex of 7 or 8, and acetyl L-carnitine 1000 milligrams a day, depending on the severity of the peripheral neuropathy symptoms. And let's not forget the role of high-dose vitamin C in reducing inflammation and prevention of oxidation from high blood sugar levels. One thing that I will mention and leave it there for you to sort of contemplate is that 75% of the mass of the human brain is made up of substance called myelin, which acts like the insulation around the electrical wire, allowing electrical impulses or nerve signals to travel quickly and efficiently along the nerve. Also, myelin is made up of 100% cholesterol. So myelin plays a crucial role in the proper functioning of nerves, and its damage or deterioration is a significant factor in many types of neuropathies. When the myelin sheath is damaged or destroyed, it's called demyelination. This damage impairs the nerve's ability to conduct electrical impulses effectively, hence causing them to slow down or even stop. This directly leads to the symptoms of neuropathy. Several types of neuropathy are directly caused by myelin damage. One of them being demyelinating polyneuropathy, or DP. This is a broad category where the myelin coating on multiple peripheral nerves have deteriorated. Then we have chronic inflammatory demyelinating polyneuropathy, or CIDP, which is considered an immune disorder where the body's immune system mistakenly attacks the myelin sheath of the peripheral nerves. Then we have Guillain-Barré syndrome, or GBS, which is an acute form of inflammatory DP, often triggered by an infection where the immune system rapidly attacks peripheral nerve myelin, leading to sudden onset of weakness and paralysis. Then we have Charcot-Marie-Tooth disease, or CMT, which is a group of inherited disorders that affect the peripheral nerves. Some forms of CMT actually directly involve abnormalities in myelin production or maintenance, leading to demyelination. Also, diabetic neuropathy, while often associated with damage to the nerve fiber itself, it can also involve demyelination due to the effects of high blood sugar on nerve health. In essence, myelin is vital for rapid and efficient nerve signal transmission. When this protective covering is compromised, it directly contributes to the dysfunction and symptoms characteristic of various neuropathies. I encourage you to think about the amount of sugars in our diet, simple sugars in our diets today, as well as the amount of proper fats that we are eliminating, and on top of that, the cholesterol medications. Beyond orthomolecular medicine, a variety of other natural and integrative therapies can be used alongside conventional treatments to manage neuropathy symptoms and promote healing, such as Lifestyle modifications like healthy diet, a balanced diet rich in fruits, vegetables, whole grains, and lean proteins that can support overall nerve health and manage underlying conditions like diabetes. Regular exercise can improve circulation, reduce pain, and maintain muscle growth. Low impact activities like walking, swimming, or yoga. Obviously, stop smoking and alcohol consumption, as they both can worsen neuropathy symptoms and should be avoided or significantly reduced. Stress management techniques like meditation, mindfulness, and deep breathing can help lower stress, which can exacerbate pain and inflammation. Adequate sleep is vital for overall health and pain management. Then there's complementary therapies such as acupuncture, massage therapy, topical treatments, warm baths, especially with Epsom salt. That can help actually soothe the discomfort and improve circulation. We also have transcutaneous electrical nerve stimulation, or TENS machines that you have seen advertised, which use low voltage electrical current to relieve pain, and chiropractic care, which can address nerve compression by improving spinal sort of alignment. Then there are regenerative medicine like PRP therapy, which is platelet-rich plasma therapy, which is an emerging treatment that aims to stimulate healing and repair of the tissues, including nerves, as well as alpha-lipoic acid IV therapy and ozone therapy. Healing neuropathy often involves a holistic approach that integrates conventional medical treatments with lifestyle modifications and complementary therapies. The most effective strategy is usually personalized based on the individual's specific diagnosis, symptoms, overall health, as well as lifestyle. Metaphysically and emotionally speaking, neuropathy can be due to stress, anxiety, and depression, as well as conditions in our life being thought of as are such that we feel powerless to create change or feeling like a victim. Hope this has been helpful. Like and follow for more. Be the light.